Good afternoon, Chair Lee and members of the committee. My name is Maggie Mortali, and I serve as the CEO of NAMI-NYC City, the National Alliance on Mental Illness. I'm also a peer, and I'm a member of the steering committee for CCIT of New York City. For more than 40 years, NAMI-NYC City has provided free, peer-led education, advocacy, and support that really reflect the diversity of our city. And before turning to the topic of today's hearing, I want to affirm NAMI-NYC's support for Intro 1162. This would require annual reporting on suicides by demographic and geography. These data are essential for designing and implementing more targeted prevention strategies, and I urge the full council to support this legislation. But today's focus is on 988. It represents a generational shift away from law enforcement and towards a public health response. When someone calls 988, they deserve care and not criminalization. The line is saving lives, but significant gaps remain. Too many New Yorkers still do not know that 988 exists. In fact, just this morning, I was talking with neighbors and they said, "What are you up to today?" And I said, "I'm going to a hearing on 988. And they said, "What is 988? Others fear calling 988, right? That it will bring police, it will bring involuntary hospitalization or child welfare involvement. Many callers connect with counselors quickly, but there are many that face delays. Language access and cultural responsiveness are urgent needs, particularly for immigrant communities, communities of color, LGBTQ plus youth, which were discussed today, and people with disabilities. We've acknowledged that 911 is often the wrong entry point for someone in psychiatric crisis, but there's still much more that needs to be done to promote 988 as that line. We need clear protocols to ensure coordination between 911 and 988 and clarity for the public about when to use each. 988 must be a promise that in a moment of crisis, New Yorkers will find help, not harm. With permanent funding and true community partnership, we can build a system that saves lives, reduces trauma, and reflects our city's values of care and dignity. And I thank you for the opportunity to testify today.